is Stephanie. I want to welcome you back to our practice and let you know that based on your consultation and examination results, we have decided to accept your case and we believe that we can help you.
Okay.
Most patients have two questions on their mind. How long is this going to take to correct my problem, and how much is it going to cost? The first question I want to answer for you is how long will it take? And the only true answer to that question is we don't know yet. Some people respond very quickly and some people respond very slowly. Until we have worked with your body several times, it really isn't possible to give you an accurate estimation of what it is going to take to correct the problem. We would like to treat you several times and then give you our estimate of how long it will take. I know that you've met with our office coordinator and she said that we'd like to see you 3 times a week for the next month.
Mm-hmm.
So we're going to continue that, and then after that we'll reevaluate and then go from there.
Okay.
We'd like you to start care today and treat you again tomorrow before we sit down and discuss our future. Based on your response to our treatment, we will be better able to present to you a program to help you achieve your optimum health potential. Now I'd like to go over with you what is causing your health problems.
Okay.
We're going to start out with the brain. The brain controls 100% of the body through the nervous system. When the nervous system is working properly and the brain is able to communicate with the body without interference, you have 100% function. So the brain communicates with the body through the nervous system, and through that you have 100% function. Sometimes the communication between the brain and the body is disrupted by an interference to the nervous system. This causes the body to then malfunction to some degree. This interference is called a subluxation.
What is a subluxation?
Well, a subluxation is a misalignment of the bones in your spine, called the vertebra, that puts pressure on the nerves that exit in between them. So you can see here that the nerves are coming out of these little holes between the two bones.
Oh, okay.
So again, the brain communicates with the body through the nervous system, and if there's a misalignment that puts pressure on the nerves, it's called a subluxation, and this could lead to malfunction. When there is a subluxation, your body will malfunction. You then get a disease process that ultimately results in symptoms.
So do you think subluxations are causing my migraines?
I think so. Symptoms of subluxations could include fatigue, digestive problems, headaches or migraines in your case, allergies, irritability, back pain and or stiffness, difficulty sleeping or insomnia, or any other health problems. I was reviewing your paperwork and I saw that your major complaint is migraines, but I also saw that you had a few of these other problems too.
Mm-hmm.
I want you to know that we are interested in correcting your subluxations so we can help you to be an overall healthier and happier person. I want to ask you a question. If we simply gave you enough care to just remove your subluxations, but left the to remove your symptoms, but left the subluxations there, would you be healthy?
I don't think so.
So if you had a choice between removing your subluxations, let me rephrase that. So if you had a choice between just removing your symptoms or removing the subluxations as well as your symptoms, what would you choose?
Well, I don't want my symptoms anymore because that's why I'm here, but I guess if subluxations are why I have symptoms, both.
If you had a subluxation and you were malfunctioning and you decided to stop your care even though just the symptoms were gone, what do you think would happen in the future?
I don't know.
Okay, I think that in the future your symptoms would return because if the problem's not corrected, if the subluxation's not removed, then your symptoms will reappear. So I just want to show you on your x-rays here. Let me pull them up. On the screen here I have Stephanie's x-rays, and what I want to show you is here is a normal spine. If you look from the back, you can see that all the bones are lined up nice and straight in a line, and if you look at them from the side, there's a normal C-shaped curve right here. There's another curve here and another curve here. And these actually have degrees that we measure, and as you can see on your film, you have no curve here in your neck. So this is what we would consider normal, and this is your neck. So can you see that you have a loss of curve here?
Yeah.
And if we show you another view, and you look from the back, do you see how the bones aren't lined up?
Yeah.
So looking at this spine, all the bones are lined up. And can you see on your spine that not all the bones are lined up?
Yeah.
Okay. So what this means to you is with subluxations and misalignments like that, the body could be malfunctioning and you could have a disease process start to occur. This process is defined as specific steps that occur leading to an end result. Disease processes are those steps that occur and lead to a disease, and all disease processes involve a loss of function. Just another example that doesn't have to do with headaches, but it might be easy to understand, is if the nerves that go down to your leg were irritated due to pressure caused by subluxation, so pressure on the nerve, they could cause your leg to slowly go numb. You would lose your normal nerve function. When the function is lost, a series of changes take place in the body. These changes are called a disease process and lead to symptoms appearing. All symptoms occur only after loss of function. Do you see that to have symptoms like you do now, there had to be first a loss of function?
Yeah.
Do you understand that if you lose function, a process will begin called a disease process that will lead to symptoms occurring? As you progress through your care, we expect the symptoms to be the first thing to clear up. So if you do not have symptoms, does that guarantee that you are healthy?
I guess not.
Okay. So you understand?
Mm-hmm.
Okay. To make sure you understand what we've gone over, I'd like to ask you some more questions. Is that okay?
Okay.
Do you think you should go to the doctor only when you have symptoms?
After what you told me, I guess not.
Okay. Do you think a loss of function will ultimately result in a loss of health?
Yeah, definitely.
And if you restore normal function, do you think the body will be able to heal itself?
That's what I've been told about chiropractic.
Okay, Stephanie, it seems like you really understand what I just went over. So I'd like to move forward with this and plan your next 2 visits.
Mm-hmm.
You will be treated again on your next visit today and your next visits. And then we'll see how you're responding to the treatment. And on the 4th visit, we will either stick to the treatment plan that we've already recommended, the 3 times a week for a month, or we will maybe have to reevaluate and come up with something different.
Okay.
So 2 visits from now, we'll sit back down again and we'll go over how you're responding to care.
Mm-hmm.
And then if you would like to bring your spouse on that visit, we could go over the x-rays with him. I know that you said he's a big supporter of yours, so I just want to make sure that he's on board with you and he understands what's happening.
Okay.
Do you have any questions for me?
I don't think so. I think you covered everything.
Okay, I look forward to seeing you tomorrow at 5 o'clock.
Thank you.